Hello, I'm Dr. Bryan D Menezes, Director, Smile Dental Care, Bengaluru. I specialize in dental implants and cosmetic dentistry. I've been practicing dental implants, including zygomatic implants, for about 15 years in Bengaluru, India. To start with, the simple and the most effective, brush twice daily, once in the morning, once before going to bed. The night brushing is very effective in terms of controlling dental plaque and removing food debris stuck in between the teeth. Do floss your teeth. You can use a water flosser, which is very effective in terms of cleaning in between the teeth. You can use a thread floss or a thread with a handle as well, whichever you're comfortable with. But make sure you floss your teeth daily. Your diet plays a very important role in maintaining the teeth. Make sure you limit the sugary and chewy and sticky food. Make sure you rinse your mouth after every meal. We always think brushing hard will clean the teeth better and make the teeth whiter. But that's wrong. When you use a brush very hardly on your teeth, the teeth gets worn out, it gets untreated, you will start developing sensitivity and pain, and worst case scenarios, you may push the gums down, the gum recession may start. Now when you buy a brush, it always comes with soft, medium, hard or ultra soft categories. My suggestion is to go for a soft brush, and when you're brushing, don't use horizontal strokes. It's preferably vertical or circular strokes, and don't use the pressure from your hand. Use the simple slow strokes to clean your teeth in between the teeth and the gums. Don't rub the toothbrush over your teeth. That may harm your teeth and the gums as well. Well, I would divide it in two categories. One is the dental origin bad breath and non-dental origin bad breath. Now the dental origin bad breath is majorly because of the dental plaque, which is the food debris which get accumulated in between the teeth or between the teeth and the gums. So you need to visit your dentist, make sure you keep your teeth clean, make sure you rinse your mouth, and you get the professional cleaning done once in 6 months. Now the non-dental origin bad breath can be because of the diet what you are intaking. If your diet involves a lot of onions or garlic, then definitely you may have a bad breath for a short period of time. It may be because of the gastritis and the acidity and other medical conditions or the medicines what you are intaking. If even after getting the teeth cleaning done, your teeth maintenance is really good, still you have bad breath, then my suggestion is to go meet your physician and take a second opinion on the reason, on the cause for the bad breath. Wisdom teeth usually come at the age of almost 20 or 22, where your jawbone growth is completed. There is no space for them to get accommodated in the jawbone. That's the reason why most of the times either they get submerged, which we also call it impacted teeth. They come towards your cheek or come towards your tongue. They lead to the issues, they lead to pericoronitis and the inflammation around the gums. So if any of this happens, we advise the removal of the wisdom teeth. No, we don't need to remove it every time, provided they are healthy, they are not causing any infection, any issues with the neighboring teeth or with the gums, and they are not impacted and have enough space to come into the bite line.